Senate Committee on Health, Education, Labor, and Pensions will come to order. And we're delighted to welcome our panelists who we're going to hear from in a few minutes. But let me begin by telling everybody what they already know, and that is, it is no great secret that in America today we have a mental health crisis, and that crisis has been exacerbated by the horrific COVID pandemic which we have experienced. And this is a crisis that has hit all of us, but I think especially the younger generation. In America today, 40% of parents report being either very or extremely worried that their child is struggling with anxiety or depression. According to a recent survey by the Centers for Disease Control, nearly 1 out of every 3 teenagers in America reported that the state of their mental health was poor. 2 out of every 5 teenagers felt persistently sad or hopeless. And tragically, 1 out of every 5 teenagers in our country have seriously considered suicide. How frightening is that? Tragically, suicide was the second leading cause of death for young people between the ages of 10 and 14, and it was the third leading cause of death among teenagers. All of us understand that the pandemic has had a huge and lasting impact on the mental health and well-being of our country and our young people. Let us never forget, and sometimes it's easy to forget, we remember the 1 million people who died during the pandemic, but over 200,000 children, often children of color, by the way, lost one or both of their parents to COVID. And think about the impact that that's had on their lives. Further, and I think we're going to hear more about this later, our kids have become less connected humanly to each other. And this is kind of a new phenomenon. And Dr. Murthy has written about this, and I'm sure we'll be speaking about it this morning. Instead of building trusting, healthy, and strong relationships with their friends, their teachers, their mentors, an increasing number of our kids are turning to their phones and social media to feel connected. And what type of impact does social media have on the mental health of our nation's youth? That's an issue that we have got to really explore at great length as a nation. According to a recent study, 32% of teen girls said that when they felt bad about their bodies, Instagram made them feel worse. More than 40% of Instagram users who reported feeling unattractive said the feeling began on Instagram. About 25% of teenagers who reported feeling not good enough, inadequate, said it started on Instagram, but we're not here to single out Instagram alone, certainly. And I'm sure that the same can be said about other social media platforms. And let's be clear, and something I think this committee in months ahead will get into. We are up against some of the best minds in the world who keep coming up with new ways to get teenagers addicted to their websites in order to sell them more products and make more money. And that's what we are going to have to address. But it's not just social media, as dangerous as that may be. Kids in Vermont, and I've been around to a lot of high schools, some community colleges in my state, but around this country as well, worry about the kind of future that awaits them. They wonder if their political leaders in this country and around the world will address climate change, or whether the world that they and their kids will grow up in will be increasingly unhealthy and uninhabitable. And I really do wonder, walking here today through the smog and the smoke that Washington, D.C. is experiencing right now, the horror in New York City. Yeah, it's a bad day, but you wonder what impact it has on the kids who wonder, is this the future for me? And what that does to them psychologically. Yesterday, on another issue, I had the occasion to meet with people who came to the Capitol who lost loved ones as a result of gun violence in schools. And I was stunned in Vermont, where kids worry. When we were young, you went to school, it was a safe haven. Now they really wonder that some terrible thing might happen. And when we talk about the anxieties facing young people, we can't ignore economics. Everything being equal, if we don't get our act together, the young people will have a lower standard of living than their parents. And right now, some 60% of our people are struggling paycheck to paycheck. So all I would say is the pandemic has exacerbated a bad situation. It is there. As political leaders in this country, it's our job to address it. Senator Cassidy, the mic is yours.
Thank you, Mr. Chair.